The same AI technology that's saving doctors 4.5 hours of paperwork every day just created the biggest job opportunity in healthcare history. And 99% of doctors and nurses have no idea how these positions even exist. Look, if you're watching this video, you probably know exactly what I'm talking about. You became a nurse or a doctor to help people, but somehow you spend more time staring at a computer screen than actually caring for patients. Dr. Sarah Chin told me she used to spend 4.5 hours every single day just on documentation. That's almost half of a shift, and that was after seeing patients all day. But here's the crazy part. While you've been suffering through this documentation nightmare, a completely new job market has exploded, and I mean exploded. The AI revolution you haven't heard about. Right now, hospitals across the country and across the world are implementing something called Ambient AI. This technology literally listens to your patient conversations and automatically creates perfect clinical documentation in real time. But here's the part that will blow your mind. Every single hospital implementing this technology needs people to manage it. And they specifically want healthcare professionals who understand clinical workflows. We're talking about roles like clinical informatics analysts, AI implementation specialists, healthcare technology project managers, and digital health consultants. Let me share some numbers that will shock you. According to recent data, there are over 15,000 open positions right now for healthcare professionals who want to move into digital health roles. Sarah Martinez, a former ICU nurse, became an implementation specialist last year. Her starting salary? $95,000. That's $30,000 more than she was making at the bedside, and she works Monday through Friday, 9 to 5. But here's the best part. She told me, I'm helping implement systems that will save nurses the same documentation headaches I used to have. Instead of helping one patient at a time, I'm helping entire hospital systems. Why healthcare professionals are perfect for these roles? Now, you might be thinking, Rod, I don't know anything about technology, but here's exactly why you're perfect for these roles. These companies don't need more software engineers. They need people who understand what it's like to chart at 2 a.m. after a 12-hour shift. They need someone who knows why nurses might skip documenting pain scores when they're overwhelmed. Michael Johnson, a former ER doc, is now a clinical transformation consultant making $140,000 a year. He travels to different hospitals, helps them implement AI documentation systems. He told me, every day I use my clinical experience to make technology actually work for healthcare workers instead of against them. Let me tell you what qualifications these companies are actually looking for. Understanding of clinical workflows, check. Experience with EHR systems, check. Knowledge of healthcare regulations, check. Ability to communicate with clinical staff, check. Understanding of patient safety requirements, check. Guess what? You already have all of these skills. The technical stuff, that can be learned. But your clinical expertise, that's irreplaceable. Lisa Park went from being a burnt-out med-surg nurse to a healthcare AI analyst in just 4 months. Now she helps hospitals choose which AI documentation tools to implement. I wish I'd known these jobs existed years ago, she told me. I could have escaped bedside burnout while still making a huge impact in healthcare. Let me break down the specific roles that are hiring right now. Program managers. You'd oversee AI implementation projects across hospital systems. Average salary, $85,000 to $115,000 per year. Clinical analysts. You'd analyze how AI tools are working and recommend improvements. Average salary, $75,000 to $105,000 a year. Training specialist. You teach other healthcare workers how to use AI systems. Average salary, $70,000 to $95,000 a year. Implementation consultants. You'd travel to different healthcare systems, helping them adopt AI technology. Average salary, $95,000 to $150,000 a year. Why now is the perfect time? Here's why you need to pay attention right now. The ambient AI market in healthcare is expected to grow by 400% over the next 3 years. Every major healthcare system, Kaiser, Mayo, Cleveland Clinic, they're all implementing these systems now. And they all need people who speak both clinical and technology languages. The early adopters are getting the best positions and the highest salaries, but this window won't stay open forever. So here's your roadmap to escape bedside burnout and 10 times your impact. Step 1. Start learning about healthcare AI and digital transformation. I'll put some free resources in the description. Step 2. Begin networking with people already in these roles. LinkedIn is your best friend here. Step 3. Consider getting certified in healthcare informatics or project management. Many programs are available online, but here's what I really want you to understand. You don't have to figure this out alone. The transformation is awaiting you. Imagine walking out of every workday at 5 p.m., knowing you've helped implement systems that will save thousands of healthcare workers from the documentation nightmare you used to live. Imagine making $20,000, $30,000, even $50,000 more per year while working regular hours and having weekends that are actually yours. Imagine your clinical expertise to transform healthcare instead of just survive it. The ambient AI revolution is creating the biggest healthcare opportunity healthcare has ever seen. The question isn't whether these jobs will be filled. They will be. The question is whether you will be the one filling them. Your clinical expertise is your superpower. It's time to use it to transform not just your career, but the entire healthcare industry. The future of healthcare needs you. The question is, are you ready to step into it? Ready to explore these hidden healthcare opportunities? Click the link in my bio to download my free digital health career transition guide. And don't forget to subscribe for more insider insights about escaping bedside burnout.